Occupational therapy focuses on everyday activities such as personal care, getting on and off furniture, preparing meals, etc. An OT assesses how you will manage with your day-to-day activities. We aim to provide any equipment and support you require prior to admission and prior to your discharge home to prevent you staying in hospital longer than required. An OT will complete an individual assessment with you prior to your admission to hospital. Please ensure you complete the furniture height form prior to your assessment with the OT. There are 3 main precautions to adhere to for the 6 weeks after total knee replacement. This is to ensure muscles and soft tissue heal properly around the operated joint. Do not cross your legs at the knees or at the ankles. Do not twist the knees. Always have your feet facing in the same direction as your face. And do not kneel. You are able to use a shower following surgery as long as you don't get the wound and dressing soaked. You can use a walk-in shower. We recommend that you shower when someone else is at home and you feel more confident. You are not permitted to use a bath or use the shower over the bath for the 6 weeks due to twisting and putting all your weight on the operated leg. You will need to strip wash at the basin whilst following the precautions. The knee will be swollen and painful after your operation, so you may find it difficult to reach to your feet when you first go home. A helping hand may be required to maximise independence in completing lower limb dressing and picking items up from the floor. Start with the operated leg first, bunch leg of material in helping hand and lower to the floor without bending. Feed operated foot through trouser leg and pull up above the knee before using a free hand to pull clothing up. Repeat procedure to dress unoperated leg and reverse process to remove clothing. Loose clothing is best. Shorts may be easier as there is less material. Skirts and dresses would also be easier. A sock aid is required to assist with putting socks on. Otherwise, you will need someone to help you after the operation. Tights should be avoided. Pull the sock around sock aid. Lower the sock aid to the floor without bending over. Feed your foot into the open sock aid. Pull the ribbons with equal pressure to pull the sock on. Adjust or remove the sock with a helping hand or shoehorn. Long-handled shoehorns can help with putting on shoes and slippers, but remember that you will not be able to bend to tie laces. You will need to purchase any small aids you require from pharmacy or on the internet. Keep it as simple as possible. If someone is around that can help, let them. Ready meals or prepared meals may be easier to start off with. If you have a table and chair in the kitchen, it is best to eat there for the 6 weeks. If possible, ask someone to carry items for you. Domestic tasks. At first, it may be easier to make use of internet shopping or ask family or friends to help with the tasks, such as grocery shopping, laundry and housework for the 6 weeks until you feel ready to do them yourself. Before coming in for surgery, stock up on your store cupboard, fridge and freezer. Move items you regularly use from bottom cupboards to waist height or above. Some charity organisations can help with light tasks once a week. Home environment. Remove loose rugs, ensure walkways and rooms are as clear as possible and well lit. Ensure you have clear and safe access around your bed and any areas you need to access with your walk aid within your home. Think about what side of the bed you transfer in and out of. Some people find it easier to lead with your non-operated leg into bed. Because of pain or your leg feeling heavy after the operation, you may find it difficult to lift your operated leg into bed. A leg lifter can support the leg in and out of bed. You are not permitted to drive for 6 weeks. This is to ensure you have full control during emergency stop. If you are having a left total knee replacement and you drive an automatic car, then you may return to driving after 4 weeks. Your consultant will advise you when you can return to driving. Make sure you check with your insurance provider to ensure you are fully covered under your policy. You can be a passenger in a car, sit in the front passenger seat, have the seat back as far as possible, recline the seat, sit down first and slowly lift your legs into the vehicle. Thank you for watching the video. Write any questions or concerns you may have and discuss with the occupational therapist when you have your individual assessment.